In 1994, the Sujat Nagar slum was built at the Jalpa of Pallabi in Dhaka city. There were no sanitary toilets nor clean drinking water in this slum. This is the Bihari camp of Mirpur. There wasn't any proper drainage system. Participatory Development Action Program, or PDAP, is a small NGO who worked with the cooperation of local people and donor associations. They arranged to set up a regular water supply, tube well, toilets and concrete slabs to cover the drainage. In the community there are 10 to 12 people living in one room, and they also run their family business from this living space. Education is the backbone of a nation. Development can only be achieved through literacy and basic education. The slum dwellers and adolescents are in the dark, and education can only bring them into the light, which will empower them. Sensing the need, PDAP started 4 education centres for adolescent girls so that they could learn to read and write and obtain basic skill development training. There are also 2 boys' schools that provide basic education. The monthly Guardians meeting is an important issue for the education program. The students' program is based upon the cooperation of Guardians, which is discussed regularly in the monthly meeting in the presence of the Executive Director of PDAP. Also, interactive games such as word making and numeric arrangement are encouraged to enhance learning and interest among the adolescents. Besides the games, annually PDAP arrange some cultural activities. Education is a basic human right, and PDAP always tries to play an active role in this regard. Practical training in skills development for adolescents enables them to earn money and help their families financially. Tailoring courses are easy training for the adolescent girls, which enables them to break the vicious cycle of poverty. Besides the tailoring course, they are also trained in embroidery and kachupi work. This enables the skilled adolescent to make attractive dresses. Their embroidery work can be shown in the exhibition or in the drawing rooms. The adolescent girls are taught block print and use these fabrics for making shari, bed covers, etc. Food processing training is another very popular program, especially jelly, jam and pickle making courses. The trained girls make seasonal pickles and sell them in different local shops. Adolescents also receive candle making training. 5 girls in each course receive the training and sell the candles in their community. PDAP has its own revolving loan fund. After receiving the skill development training, the trained girls receive a loan which enables them to earn more. PDAP takes care through health intervention. During adolescence, boys and girls are growing physically and mentally. During this changing phase, adolescents need support and counselling. On community demand, PDAP's health centre is now open for all and treatment is free. There are some special consideration for the adolescent girls, such as free medicine and treatment, regular health checkups, and they receive the tetanus injection or vaccine free of charge. An experienced doctor is attending patients every working day at PDAP's health centre. He handles the patients carefully. Skin disease, diarrhea, fever, stomach problems and abdominal pain are very common. Also, PDAP's paramedic is doing regular antenatal checkups for the pregnant women in the community, and they can obtain necessary medicine at reasonable prices. PDAP has a good partnership with the Dhaka City Corporation. For a long time, PDAP is continuing the extension program for immunisation, also known as EPI, for the children and adolescents. The City Corporation is providing free tetanus injection, vaccine and vitamin A capsules for the children and adolescents. A vaccinator and paramedic provides vaccines for the adolescents and children. Initially, the girls and children were afraid to receive injections, but later on they became used to it. PDAP is always trying to support the adolescent girls and women with legal aid. In the community, girls are more vulnerable than boys. The level of torture towards girls is very brutal. The PDAP's lawyer is handling all complaints, especially the torture of women, restitution of conjugal rights, dowry and physical assault cases.
মারধর করে এবং কোনো খরচ করতে দিতে চায় না এবং ওরা যে ডাওয়ার মানি যে একটা সিস্টেম আছে ওরা না আমরা তো এখানে প্রায় 50% কেসই আমাদের সালিসের মাধ্যমে মিডিয়েশন যেটা বলে সেটার মাধ্যমে শেষ করতে পারি আমরা আমার তো মনে এখন তো আমরা অ্যাওয়ারনেসও দিচ্ছি তারপরে আমরা কেসগুলো যে প্রথম আমরা রেজিস্ট্রেশন করি তারপরে ওদেরকে পক্ষকে অ্যাওয়ারনেস যে সেশনগুলো দিচ্ছি যে সাবজেক্টগুলো এগুলো হচ্ছে বার্থ রেজিস্ট্রেশন আর্লি ম্যারেজ, divorce, dowry, dower money, child right, trafficking, GD&T, guardianship.
The lawyer counsels and creates awareness among the community about family law, child and adolescent rights, women's rights, etc. First, she tries to solve the problem through negotiation on both sides so that the case doesn't need to be filed in court. Through advocacy, PDAP focuses and provides leadership training for the empowerment of adolescents and to help improve family life. Trained adolescent girls and boys share it among their peer groups and friends. Community-based health sessions are also promoted. PDAP's working area is mainly Dhaka-based, but in 1998, PDAP started to work on a relief distribution program for the flood-affected people of Munshiganj district. PDAP is continuing its advocacy program through seminars, workshops, human chain, rally and other printed materials. Last but by no means least, PDAP wants to say that adolescents are an asset in our society. If they are given an opportunity, they can improve their lives and look forward to a more prosperous future.